Okay, let's discuss the last part, which is for the monocular subjective refraction. That is part 5, monocular spherical endpoint and spherical equalization. Okay, let's directly dive into it. So spherical monocular, which is fifth part, we know up to cover with fourth part, and sixth part is spherical equalization. So monocular spherical endpoint, traditional and the duochrome method. There are two methods. Okay, so traditional spherical endpoint and the duochrome or bichrome method. So let's discuss two. So traditional spherical endpoint method, the residual spherical eye is fogged until the severe previously visual lines and acuity are blurred each other. Basically, it's fogging and unfogging. Okay, basically it's that because see, because till the point fourth point we already resolve cylindrical power, isn't it? Now we have only point image of the any object because we correct cylinder. Now we want that point image to come in front of retina and just touch the retina so that our accommodation relaxed, so that we put highest plus and lowest minus, which we already defined in subjective refraction. The target is always that. So that's why in case of traditional spherical equivalent, we use, what do? We fog and unfog. That's simple. Okay, so basically we again push the focal point in front of retina and push back to the retina, just optimum. And then we do, what do? We fog first and then unfog by 0.25 step until spherical length of a maximum visual acuity is reached. That is spherical length. And what is that spherical length? Lowest, lowest minus and highest plus. Basically means accommodation is relaxed, isn't it? So provided maximum visual acuity. The endpoint in case of traditional spherical endpoint is visual acuity can no longer be enhanced by adding minus or reducing plus, which basically means adding minus, isn't it? Reducing plus means adding minus. But what is the endpoint? Endpoint is the visual acuity. So we reduce plus, which means definitely addition minus in 0.25 step, and at the end point is visual acuity no longer enhanced or visual acuity remains constant, or becoming blur is quite difficult because adding minus is we tend to accommodate more and make sure visual acuity is clear. That's why the better way is second way, basically duochrome method. So duochrome chart is presented in a dim illumination. We always do duochrome in dim illumination. Patient is asked whether the letters are equally prominent in both background or either one. So we know what is duochrome. So slightly fog the vision, adding plus lens. So letters until the red background is stand out. So we don't want this green background letters stand out at the end because we want slight either equal. If equal is not possible, then we will go to slight red because it means minus under correction. It means plus slightly over correction because we always prefer red becomes slightly clearer than green. It's always that, isn't it? So basically, reduce plus sphere until the letters on the two chart appears equal distance as residual emmetropia endpoint equality, or I have always emphasized this, or very important in case of real subjective refraction, until next reduction of 0.25 makes the letter on the green background more distinct as slightly residual hyperopic in the first green. So we know in first green there is slightly hyperopic, but that's not the point. So sometimes if equalization is not achieved, first green is most prominent appropriate endpoint, particularly in young patient with active accommodation. So if accommodation is active, then slightly green could be there, but it's I have not, I never choose this point in my personal opinion. I don't know about other optometrists, but I never choose the first slight green. I always choose red because accommodation, uh, I don't want to over accommodate patient. That's my personal personal suggestion, but you can find out by doing your own practice because that's better for you as an individual. But see this second point, whereas in presbyopia should be left at last rate. So previous, so to preserve the accommodation, I always prefer this second point. I always, I don't know about you, you can find out by your doing your own practice. Okay, so so spherical equalization, this is the sixth point, isn't it? The last point is spherical equalization. What is this spherical equalization? And purpose of spherical equalization. Sometimes spherical equalization we call binocular balancing, which is famous in the case of optometrist. So just remember what is the purpose. It's always it has been always asked in Viva. So, and lot of students say spherical equalization, purpose of spherical equalization is visual acuity, balancing visual acuity. Oh God, that's absolutely wrong. Because see, purpose is binocular balancing is not balancing the visual acuity. That's clear in the definition. Not balancing visual acuity, but to balance the state of accommodation of the two eye. We want the two eye accommodate equally, not either right eye accommodate more and left eye accommodate less. That's not the purpose. The purpose of spherical equalization, aka binocular balancing, is to balance the state of accommodation of two eye. It's crucial. I know you are going to be judged by this answer, that how much refracts subjective refraction you have read. Okay, if the correction of visual acuity is same in both eye, the balancing procedure may consist of comparison vision. May, just remember this, may compare. It's not always two eyes have equal vision, doesn't mean two eyes have equal state of accommodation. That's very important. So if the correction, and there is chances that it can be happen. Okay, so if visual acuity is same, chances are comparison visual balancing of accommodation is quite same. But that's not, just remember this word may. Okay, if the corrected visual acuity is not same both eye, the anisoaxiopia, which means difference in visual acuity, then the method not balanced visual acuity must be used. So if visual acuity of the two eyes are not equal, at that case we don't rely on the visual acuity based procedure. It's quite important to understand. So if both eye has different visual acuity, then that condition is known as anisoaxiopia, which is frequently asked MCQ question. Okay, so unequal accommodated response between the two eyes, then inequality in the clarity or size of the retinal size of the two eyes. So reduced visual stereo acuity, isn't it? Or fusional amplitude. So that's why it causes discomfort and visual inefficacy. So that's why we have to understand, we have to make sure the accommodated state of two eye are equal, and that's why we do binocular balancing, isn't it? Okay, fine. So common technique for spherical equalization or binocular balancing is alternate occlusion method or prism dissociation method. Yes, definitely alternate occlusion method we use visual acuity primarily, but in this case we use prisms and by duochrome test or bichrome test. Okay, so alternate occlusion method, I'm just simply going to read, and if there is anything I will emphasize. Okay, both eye are alternately occlude repeatedly while the patient's view distance visual acuity through the spherical cylindrical correction determined monocularly. We determine spherical cylindrical correction and then we repeatedly alternately occlude both eyes and perform with handle cover pedal, and patient is compared and inform the eye is resolving more later chart. So if examiner then adjust the spherical balance so that to produce equality in both eye. So we just occlude one eye and then move to another eye, and we ask the patient if there is the difference in visual acuity or if it's comparable visual acuity, then according to that we adjust the spherical component. So not helpful in anexoxyopia, I have already told you, not helpful in anexoxyopia patient and amblyopia patient. It's not helpful this particular way of spherical equalization. Okay, subject compares the visible object with the previous one and remember and no longer visible. Okay, it could be must be repetitive and slow enough the patient recognize and accurately state the, if you are dealing with visual acuity, then you have to give your patient time so that his response is accurate as possible. Okay, has to be fast enough so that patient cannot accommodate or residual hyperopia eye will be uh, while other eye is occluded. So not fast, not slow also. Okay, so that's important, because if you give plenty of time for, if there is an residual hyperopia, then eye will accommodate and makes it clear. So basically in this technique you want both eye have equal what you call visual acuity. So for that you either reduce plus power and add minus power, or if there is a far better eye, clear in right eye, then one eye, then you will add plus. Basically, we always want at the end, or try to do, is dominant eye a little bit better. Okay, dominant eye, you have to do dominancy test, so that's always better. Always leave the dominant eye a little bit clear than non-dominant eye. Okay. So prism dissociation technique, what is this? So basically we place three prism base down in front of right eye and three prism base up in front of a left eye, so that six prism difference. And we know vertically we have only one to two prism fusion, that's why two eye dissociates, isn't it? The chart gets separated vertically, and upper chart is being seen by right eye because it's base down, basically image shifted towards the apex, and the lower is left eye because left eye we put base up, so that image shifted towards the apex, which is down. The patient is asked to report whether these letters are more distinct or easier to read in upper or lower chart, and again we rely on visual acuity. If the two 25 lines are equally distinct and two eyes, the accommodative state of the two eyes is considered to be balanced. So our reference is visual acuity is 6-9 line, and if 6-9 line is equally distinct from the two eye, then we consider there is a chance of uh, a balancing between two eyes. So that's the rough point using visual acuity and prism dissociation. But if patient reports different clarity on the letters for the two eye, then what we'll do? See, this is the condition. If patient say that there is the difference in clarity of the two eye, then what we do? We add 0.25 in front of the eye with a better vision, and the test is repeated. It's always important. Not we are not going for the worse vision eye. We are going for the better vision eye, and we try to add plus, so that that's vision of that eye gets slight reduces slightly. Okay. Once the patient visual acuity is balanced 6-9, the patient is defogged binocularly to that criteria. So it's very important. So suppose right eye is better, then we add plus till 20/25, which is 6-9, and then we defog binocularly. Okay, in point of the balance is equal equity, and when in point of the balance is reached, remove prism and find binocular spherical in point. Okay, so when we got equal vision, then we definitely remove the prism and see all these things. So basically difficulties with the subjective refraction test technique. Okay, wait, okay, I have to add one more thing that I forgot to add. Whenever we do this particular test, that is prism dissociation, we can also do one thing. We can add these two things, prism dissociation plus bichrome test, which is more reliable, even more reliable. Okay, and in case of prism dissociation, we can use visual acuity too, and we can use binocular bichrome test. Bichrome test is more reliable. So basically we add three prism and three prism based on, and we show patient what that by duochrome test, and then we balance, and we know how to balance with duochrome test, how to do red and green and all these things. Okay, that's another thing that we can do. Or in case of visual acuity, that's the point. 6-9 is very important line that we will always take as a reference. Okay, so difficulties with subjective refraction testing is basically it's very important to patient have cooperation. Past experience is important. Yes, definitely patient should be intelligent and give good subjective response and good subjective response to the examiner, to the optometrist. Okay, and another thing that is important is size of the pupil. The smaller the pupil, the increase in depth of focus, so which creates ultimately inability to discriminate between the lens choices. So that's why it's always difficult with a small pupil eye to do subjective refraction. You just remember this point. This you will face in your life as a clinician. Okay, the test factor, target and room illumination also important. Target testing, target is also distance also important, and retinal adaptation is also important. So that's very important in case of subjective refraction. Okay, so what is the advantage of trial frame over the phoropter? What is the advantage of trial frame over the frame? And that's the main, and this is far more important when we are going to deal with the low vision refraction. I think I will discuss later on in case of low vision refraction. But In case of low vision refraction, the advantage of trial frame over phoropter is huge. But definitely, here too we will discuss. Okay. So in case of advantage of trial frame over phoropter, first is water resistance, pantoscopic tips, and phase form. These three things is always far better to adjust with the trial frame. That's very important. And it's always better if patient has torticollis. Trial frame is always better. Okay. And better for near vision, a near subjective refraction. In case of, if you want to prescribe near vision, then trial frame will be always better. Some encounters proximal accommodation with phoropter. You know proximal accommodation, isn't it? Proximal accommodation means one of the component of accommodation which is stimulated by when you think that object is nearby, which is object is proximal, then that part of accommodation is stimulated. So in case of phoropter, because of all the system phoropters has, a patient feel like its target is proximal, target is near. So so in case of phoropter, there is a chance that if target is near, then patient accommodate, and there is a huge chance that minus power is overcorrected. Minus power, they accept more minus power. That's important to understand. Okay. So these are the things for monocular subjective refraction. Definitely great book to read, and I have taken this too, but this is gold for as a procedure. Okay. Okay, here's the end of monocular refraction. Subjective refraction, definitely. uh, Bistan, choose.